think we're going to start off kind of looking into the future, and I'm going to talk about telesurgery for prostate cancer, because I think this is something that you're going to see very shortly. I'm going to talk a little bit about the roots of robotic surgery and where telesurgery has come and where I think it's going to go towards the future. So what is telesurgery? Well, it really is an intersection between medicine and technology. And I think it's going to play a role in the future in a number of different areas, not only allowing access to underserved areas, but it allows expert surgeons in one area to perform surgery in underprivileged areas. We have applications already in cardiovascular and neurosurgery, and I think it's going to have a significant role in surgical training, and I'm going to try to demonstrate some of these areas and talk about what the pitfalls are going forward. Well, where are the roots of robotic surgery? They date back actually to 1980 with Rick Satava, who was part of the DARPA project, which was really founded the foundation for the Da Vinci robotic system. And really what his charge was to develop a robotic system that could be remotely controlled by surgeons to help soldiers in the battlefield, to stabilize them and then get them airlifted to a safe site. And then the first use of telesurgery actually occurred in 1991. And Jacques Marcoux actually did the Lindbergh operation, where he was in New York City and took a gallbladder out of a patient in Strasbourg, France. And we'll explore a little bit about the challenges with that. And that was the first transcontinental telesurgery operation. We actually started to see telesurgery being used remotely in Canada by Dr. Avari with McMaster University and North Bay Hospital doing general surgical procedures. As you know, Canada's got a vast territory. Getting surgeons up to these underprivileged and remote areas is really a little bit of a challenge. But this all stems back actually from 1994, when the European nations put together the Minimally Access Surgery and Telecommunications Robotic Grant. That actually paved the way. At that same time, a robotic company named Computer Motions developed the Zeus robot. This was eventually gobbled up by Intuitive and was killed pretty much to prevent any competitive. But what the Zeus system had, it did have a prototype that allowed, with optic fibers, communication between one site and a separate site. And so actually in May of 2021, ethical approval for this operation was approved. Actually, the surgeons actually went to the FDA, and the FDA actually rebutted it and said, we're not going to allow this, we're not quite there. The president of Chirac of France actually thought it was a pretty incredible idea and really promoted it and allowed it to happen in his country. And as you'll see, this is where on September 7th, the first robotic telesurgery occurred, with the surgeon actually staying in New York and operating in Strasbourg, France. And this is what the room looked like. And it kind of reminds me of when the early Apollo missions and all the space missions, you can see a command center. It was actually very elaborate. The Fresh Telecom system laid cable from New York to France. Here is the first robotic system. You can see here are the surgeons, and you can see the instruments are very primitive compared to what we have. Here's how the control of the instruments takes place. And you can see the surgeon here taking out the gallbladder, freeing this up. And you can see it's like almost like a space type of ship, taking off and being done.
Una donna di 68 anni a Strasburgo.
These are the articles that appeared.
Puis je vous le disais en titre, une première en matière médicale. Le chirurgien a opéré de New York une patiente qui se trouvait à Strasbourg.
이제 환자들은 세계 유명 의사들로부터 먼 거리에서도 수술을 받는 게 가능해졌습니다.
So you can see 450 articles, the initial publication. It didn't get a lot of press in the United States. And the major reason was, if you look at the dates of these, September 11th seemed to dominate all the news in this cycle. But it did make some press.
It's The Tonight Show with Jay Leno, featuring Kevin Eubanks of The Tonight Show Band. And me, I'm Ed Hall.
Hey, here's an amazing story. Here is an amazing story. Surgeons in New York City used a remote-controlled robot to remove the gallbladder of a woman in France. You following me here? From monitors, TV monitors in New York working the controls, they were able to use the robot in France to remove her gallbladder. In fact, right now, as I'm standing here, there's a doctor in Belgium checking my prostate.
So here you can see, obviously, but actually it wasn't really until 2005 when the Canadians actually, from McMaster University, with general surgeons up in North Bay Hospital doing general surgical procedures and really opening up this can of worms, if you will. The first telesurgery, at least with prostate surgery, took place actually in November 27th of last year. Dr. Vip Patel from Orlando, Florida, flew over to China, and he used the Edge robot. And you can see 2,900 kilometers between the distance. You can see the latency time with a dedicated fiber link was about 21 milliseconds. They actually used a microbot, which is another type of robot in China, to do a partial nephrectomy. But this really opened up the way. And then also at the same day, they actually did a triple consult surgeon where they had three surgeons, two surgeons operating on a patient in a third location. So the technology was here. They used a 5G network for this to occur. So why is telesurgery important? Well, it really kind of levels the playing field. We have about 310 million surgeries that are performed each year. Less than 5% of these are done in a minimally invasive fashion. 94% of lower income nations don't have any access to safe surgical care. 14% of people in high income countries have no access to surgical care. And if you look in the African, sub-Saharan Africa, almost the whole population have no access to care across the board. So why is telesurgery needed? Well, there's about 5 billion people in the whole world that don't have any access to surgical care. And this is one way that we can provide that type of care. You can see that there's inequality across all the nations. Switzerland spends about 700 times more than they did per capita in Madagascar. Early in my career, I spent time in Pakistan developing health programs for the World Health Organization. And Pakistan, the country, spends 12 cents per person per individual on healthcare. When you think about 12 cents, what can you develop? Well, the programs that we developed were hand washing, maternal and child health programs, nothing sophisticated. Those programs play a significant role in the healthcare of these countries. There's also a lack of medical trained professionals. We need about 18 million additional healthcare workers to achieve universal health coverage by 2030. 950 million spend at least 10% of their income, and there are 100 million people that are pushed into extreme poverty, and access to healthcare is really limited. If we even just look in the United States, the dark green areas represent uninsured people in the United States, places like Texas, Florida. You can see Nevada, across the board. There's still an inequality even in our country, which is a very developed country. Well, here is the challenge for us, and the challenge is what we call latency time, the time that it takes to transfer auditory, visual, and even tactile feedback between two distinct locations. And now I think we have the technology. We try to get this latency time below 150 milliseconds to allow this to occur. And the reason for this is you can see here that when you're 100 milliseconds or less, you're really unaware of any kind of differentiation or lag that exists. When you start getting up to 200 to 300, you become very aware, and the chances of making mistakes increases rather significantly. And now we have the telecommunications with 5G that this really shouldn't be a technical barrier. And so why is telesurgery now? Well, we've got this telecom revolution taking place. We've got fast, low latency and cyber-secure systems. We've got fiber, satellite, and even 5G systems that work. There's really a wider adoption across many advanced nations for these kind of telecommunication systems. And we have artificial intelligence that can predict gaps in these networks and allow workarounds around congestion. So when Vip did his first prostatectomy in November of 2023. It took 85 minutes to do it. The blood loss was 100 cc's. There were no complications. There was no perceptible jitter or visual delays. And really, just having the technology, though, doesn't solve the problem. There are lots of challenges, and this lists some of the challenges. You know, the technical challenges I think we've overcome. There are some resistance to adoption and patient awareness, but really the economic issues are really the major stumbling block going forward. You see this hyper curve on the right side of the slide. There's a peak, inflated expectations, then you get to the delugements, and then you start to plateau with the productivity across the board. So when we think about the future, you have to look at the imaging systems, the ergonomics of these systems, training these systems, and the cost and accessibility to the systems. There are ethical considerations, you know, informed consent, what rules are going to play a role. Is it going to be in the country where the patient is or where the surgeon is? You know, and there is issues with access and equity across the board. And then there's obviously the medical, legal, and public policy issues that range, you know, the physician-patient relationship, you know, the medical liability, and then the cultural sensitivities and diversities that exist. So there are some humanitarian benefits, you know, expanding specialized care. We now see it. We can do it in urology with prostatectomy and partial nephrectomies, and I think this is only going to start to expand. We're understanding that it can enhance surgical training across the board and education as we go forward. But there is a long road ahead. You know, we have the technology. We need to make sure it's reliable, redundant, and we can scale it. There are global and privacy and regulation issues, and the implementation issues across the board can be significant. So I think there are some lessons learned. One is I think patients will accept telesurgery if it's safe and effective, and if they perceive that there's a benefit and it offers less travel. You can train local surgeons very effectively how to use telesurgery. We do have the bandwidth, you know, to make this stable and secure, and there's very little disturbances in the networks. There are regulatory and medical legal issues that still need to be worked out, but I think practice demands evidence, and evidence establishes the practices. And I think going forward, we're going to develop partnerships with private organizations as well as public organizations. You know, the big challenge is, you know, just because we can do it doesn't mean we should do it. We have to do it in a regulated and a well-systematic form. The latency issues, I think we started to overcome across the board. And I like this diagram because I think it isolates and it illustrates, you know, trust, safety, and confidence is what we expect in our surgeons when we do any type of surgery, whether it's, you know, robotic surgery or open surgery. But you can see there are many different parts to this puzzle. It's not just doing the procedures, but it's in doing it with the trust and the safety and the confidence ahead. This actually led to the first telesurgery conference that we had in Orlando of this year, in February of Orlando, in which we brought members from the FDA, the White House, surgeons from all across the world came to Orlando. And this is the representation that now this is really starting to get some groundswell. We're starting to see surgeons all around the world starting to embrace the first telesurgery procedures in Africa actually took place last week. So we're starting to see this expand across the country, but we need to do it in a regulated way, and I think we'll start to see that going forward. Thank you very much.